Republicans want to repeal and replace the Affordable Care Act. The Senate, they've actually now put their bill forward. Now that we get a chance to actually read it, folks are just stunned by how utterly ridiculous it is. It was crafted in private, no input from Democrats. Obviously a total contrast to what took place with the Affordable Care Act, but you wouldn't know that listening to Republicans lie on national television yesterday on the Sunday morning show. 5 Republican senators are on the record as a definite no on the bill, but you know, those things can change very easy, like folks like Senator Ted Cruz. Now, 4 of them say the measure doesn't go far enough in the repeal, while Senator Dean Heller of Nevada, up for re-election next year in a state Hillary Clinton won in November, says the Medicaid cuts in the bill go too far for him to support it. Now, Republican Senators Ron Johnson of Wisconsin, Susan Collins of Maine expressed their concerns about the bill on Sunday talk shows.
I would like to delay the thing. There's no way we should be voting on this next week.
For my part, I'm very concerned about the cost of insurance for older people with serious chronic illnesses and the impact of the Medicaid cuts on our state governments, the most vulnerable people in our society.
Now, Senate Democratic leader Chuck Schumer of New York gave his assessment of the Senate GOP's bill chances and said his caucus would go down swinging.
Democrats, we are doing everything we can to fight this bill because it's so devastating for the middle class. I think they have, at best, a 50-50 chance of passing this bill. To get 3 senators to vote no, you can say yes, you can say no. It's probably 50-50.
Now, former President Barack Obama is also jumping into the fight over the dismantling of his signature achievement. In a Facebook post, he said, quote, "The Senate bill is not a health care bill. It's a massive transfer of wealth from middle class and poor families to the richest people in America. It hands enormous tax cuts to the rich and to the drug insurance companies, paid for by cutting health care for everybody else. Those with private insurance will experience higher premiums and higher deductibles, with lower tax credits to help working families cover the cost, even as their plans might no longer cover pregnancy, mental health care, or expensive prescriptions. Discrimination based on pre-existing conditions could become the norm again. Millions of families will lose coverage entirely." Now, what's interesting here, he used the word mean, and then, of course, President Donald Trump, angry that President Obama, how dare he use his words, did an interview with Fox News where he said, "He used my words. I said it first." Okay, this is how dumb that is. He was actually then confirming at the actual bill passed by the House, which he celebrated in this ridiculous show of unity in the Rose Garden, was actually mean. Y'all hear that? He gets mad at Obama for using mean. Then Trump takes credit for calling the bill mean, which means that if you one of the folks who voted for the bill, he just made you look like a fool because he said it's mean. Joining us via FaceTime from D.C. is Karine Jean-Pierre, Senior Advisor and National Spokesperson for MoveOn.org. Joining us via Skype from Rochester, New York, is Anita Cameron, a disability rights activist for ADAPT. Karine, it's very interesting when you look at, just how utterly ridiculous the president sounds here. Then, of course, you had Kellyanne Conway going on the Sunday show saying, no, there are no Medicaid cuts. We're just slowing the payments down.
Yeah, good morning, Roland. It is what we're seeing is pretty. We keep using the word unprecedented, but that's what this presidency has been. That's what the 18 months of campaigning has been for Donald Trump. It's business that is not normal, that is not usual. And let's not forget, Roland, I know you've talked about this. His foray into politics back in 2011 was saying that Obama wasn't even born here. So we know how Donald Trump feels about Obama. But yes, so this bill, the House bill, was mean. And what happened was in the Senate, as we have been seeing, which we thought there were grown-ups in the Senate, they actually turned a mean bill into a cruel bill. And I have to tell you, Chuck Schumer says 50-50. I think it's more like 60-40. I think there's a very good chance that this bill is going to get through, because just like they went into a back room with 13 men to put this horrible bill together, they're going to make backroom deals. And I think McConnell is going to beg, bribe, and steal to try to get this thing through. And so we really have to come together as a country, because majority of the country do not like this bill. I spent a lot of time on the road this weekend at these rallies, these large events that we've had. Thousands of people showed up in Ohio, in Pittsburgh, in West Virginia, that Move On did with Bernie Sanders. And people do not like this bill. They are very loud and clear. But Republicans want to give a big tax cut to the wealthy, and that's what they seem to not care about anybody else.
Well, this is also, frankly, a bill where it gives the impression that, look, they just want to pass something. Let's just pass something to show people we actually pass something.
I agree, but also let's give millionaires and billionaires a big tax cut as well. It's when you have your even moderate Republicans and Republicans, senators, and also governors, in particular governors, saying, hey, do not mess with Medicaid. We need that. Do not touch it. And they're still gutting it worse than the House did. I think you also have to think, well, do they not care about people? So I think there's a level here of okay, well, who are you guys working for? Is it the insurance companies? Maybe that's it. Maybe your own pockets. So you have to ask that question as well.
Anita, I want to go to you. One of the things that's interesting is that you have folks like Senate Majority Leader Mitch McConnell, whose life was saved as a child when he had polio by March of Dimes. But he won't even meet with March of Dimes today because they oppose this bill. AARP opposes this bill. American Cancer Society. You can go down the line. Diabetes Association. I mean, group after group after group that works with and helps regular Americans, the phrase Republicans love to use, and he won't even meet with them. That says a whole lot.
It does. It speaks volumes. And I'm not surprised at all about that. I was one of the people who did the die-in outside of his office, and so I'm not surprised.
And of course, what you're talking about there is when people were literally handcuffed and carried away. I mean, he won't even meet. And first of all, what's amazing to me is his state of Kentucky is going to be one of the hardest hits as a result of these cuts. Where are these broke white folks who are going to be impacted? Why are they not saying anything?
I really don't know. I don't understand, how it is that people vote against their own self-interests, do things to harm themselves because, they didn't like the black dude that was in office, and, all of that, or continue to agree and support someone who is leading the charge to enact, to get a piece of legislation passed that will literally kill people with disabilities and devastate the lives, of folks over the next 10 years if it passes. I don't understand why people do that. Maybe when they begin to get directly affected, they'll join us in opposing this or doing something or whatever, but of course, by then it'll be too late, but I think that's kind of the way that is. They'd rather think, I'm glad I'm not one of them, or those people aren't me, they're just useless eaters who should probably die anyway, and this isn't going to affect me. But it will. It will affect millions.
I want to bring in our panel here. A. Scott Bolden, attorney and former chair of the D.C. Democratic Party, along Victoria Burke, political analyst and writer, NBC Black, Eugene Craig III, CEO of the Eugene Craig Organization, with also Maryland Republican Party. I'll go to you, Lauren. will we see massive pressure this week? The only thing that's going to change this is going to be phone calls, emails, going to their offices, because otherwise, I mean, what McConnell wants is he wanted this thing to be done quick and easy, limited public pressure.
Right, and right next to a major holiday. Frankly, I don't detect any Democratic comms. There is a meeting at 1 o'clock that should reveal Democratic comms, but we're not really seeing anything from the Democratic Party in terms of an organized effort to fight this. I suspect, good thing that ADAPT showed up, good thing that the Indivisible folks show up, because they're really the strength of the resistance, and if it wasn't for them, I think the Democratic side would have no messaging. But all their messaging, frankly, should be Maxine Waters style, and instead it's very quiet, it's very cerebral about going, you know how they do their sort of bullet points about the bill. That doesn't work. We live in an age of Donald Trump messaging, and the Democratic Party has not caught up with that yet. And I'm hoping that today, for their sake, that they have something to show for it, but I don't see anything yet.
Scott, pressure is the only thing that's going to actually change this.
It's not clear that pressure is the only thing that's going to change it, because while you've seen some pressure, the Democrats can't stop this bill.
No, I don't mean Democrats. When I say pressure, I mean pressure from the public, like we saw on the House side, literally blowing their phones up, and not just targeting 5 U.S. senators, but targeting as many as possible, but especially those individuals who are up for re-election next year.
Absolutely, and the pressure has to come from those groups, AARP, the American Hospital Association, and every other major organization. On the Senate side, that's been kind of quiet too. Only 17% of the people in this country support this bill. You've got the CBO report coming out. Maybe we'll see more activism after that report comes out. But remember, I think another strategic piece is that whatever they pass, quite frankly, is going to have to go to conference committee, and maybe that's where the big fight is, if you will.
Eugene?
You know, I think this bill is probably not going to get a vote this week. With 5, Republicans already against it on one side, and the likes of Rob Portman and Susan Collins and Lisa Murkowski on the other side, it's a topsy-turvy. Either way, I mean, you will not see a 51 vote majority get on this bill. Either way. But also there is already pressure against the bill, particularly for folks on the right. I know Freedom Works has come out against the bill. I think Heritage also has come out.
But what's the big rush with your party? What's the big rush?
That's because it's not mean
I don't think look, I'm a regular order guy. I think this bill should have went through the committee process. I think we should have open hearings on it. I think any bill that's crafted behind cloak and dagger and back rooms is a bad bill. Words that I've said when we had TARP. I think this applies the same with this bill.
See, Roland, that coordinated pressure you were talking about with regard to people on the ground is sometimes spurred on by the party. Republicans do this really well. You guys do this really well. They coordinate their media, not only coordinate their media, but their groups, and the Democrats don't do it.
Corinne, real final comment, that pressure, again, I don't fall into the category of, oh, it might not pass. You got to put the pressure on to ensure it doesn't pass. 20 seconds.
I agree. I don't fall into that category at all. I think this is the closest that Republicans have come to getting this done. I can't even believe that the Senate is even doing what they're doing, but they are. And so the pressure needs to be from the people, from the grassroots. They're the only ones that are going to be able to stop this. And that is the phone calls. If you're able to come to Washington, D.C., I know that's asking a lot because not everybody can do that. Get on a bus. If you're in a summer break, come to the D.C., come to the Capitol. There's going to be a gap. I think their Senate Democrats are doing a talkathon tonight. Well, come on out for that. Go to the gallery. Just be visible and call.
They can talk all day, but constituents from those states
need to show up.
But constituents from those states need to be talking to their United States senators.
Exactly. Need to make those calls.
Corinne and Anita, I appreciate it. Thank you so very much.
Weekdays on TV One.
I will never lie to you.
Oh my God.
Roland Martin.
He doesn't want to talk to us. He wants to ignore us.
Uncensored.
Hell no.
That ain't gonna cut it, boo.
Unapologetic.
No, that is fundamentally false. You are wrong.
Unfiltered.
He wants an America where we all look alike. He ain't talking about black people.
Unrelenting.
You better go work out, because you got a fight on your hands.
NewsOne Now with Roland Martin. Weekdays at 7 a.m. on TV One.